Good afternoon, guys. We are discussing for a condition where a cardiovascular condition called hypertrophic cardiomyopathy. Abbreviation is HCM, a disease often called a silent killer because it hides in plain sight. The article emphasizes that 85% of people with this condition are undiagnosed, underscoring how easy it slips past routine medical care and how devastating its consequences can be. Okay, so that is today's A for y'all. We are going for the next page, which is 85% undiagnosed. This figure highlights the enormous gap between prevalence and detection. Most people with HCM never know they have it until a crisis occurs. Silent killer. This phrase reflects the paradox. Patients may feel healthy, yet the condition can trigger sudden cardiac arrest, especially during exertion without warning. The condition in focus: hypertrophic cardiomyopathy. Definition: HCM is a genetic heart disease where the muscle of the left ventricle thickens abnormally. This thickening can obstruct blood flow and debilitize the heart's electrical system. Prevalence: it is one of the most common inherited heart conditions, affecting about 1 in 500 people worldwide. Despite this, most remain undiagnosed, which is why headlines stress the silent killer, the silent danger. Inheritance: HCM often runs in families, passed down through autosomal dominant genetic mutations. A patient with HCM has a 50% chance of passing it to their child. Why detection is so poor. Subtle or absent symptoms: fatigue, mild breathlessness, or palpitations are easily dismissed as stress, aging, or lack of fitness. Routine exams miss it. A stethoscope or blood pressure cuff won't reveal HCM diagnosis. Usually requires imaging like an echocardiogram or MRI. Family history overlooked. Unless unless a relative has a sudden cardiac death or is diagnosed, families may not realize they carry the risk. Healthcare gaps. Many people don't undergo cardiac screening unless they present with severe symptoms, leaving inherited conditions invisible. Red flags to pay attention to: fainting, syncope during exercise, unexplained chest pain or pressure. Palpitations or irregular heartbeats, shortness of breath, disproportionate to activity level. Family history of sudden cardiac death under age 40. These signs often prompt cardiologists to investigate HCM more closely. What can be done? Clinical evaluation. If symptoms or family history raise concern, a doctor may order an ECG, echocardiogram, or genetic testing for the condition. Family screening. Relatives of someone diagnosed with HCM should be evaluated since the condition is hereditary. Lifestyle adjustments. Avoiding extreme exertion or dehydration can reduce the risk through medical guidance is essential, or though medical guidance is essential. Medical management. Treatments range from medications that reduce heart strain to implantable defibrillators for those at high risk of sudden cardiac arrest. Why are these matters in public health? The headline's urgency reflects a broader issue. Inherited heart disease are under-recognized, and sudden cardiac death in young athletes or seemingly healthy adults often traces back to underdiagnosed HCM. Raising awareness is critical to closing the gaps between prevalence and detection. Final note: this explanation is based on the surrounding pages. Framing of a silent Give me 1 second, folks. Framing of a silent killer with 85% undiagnosed cases, which align with hypertrophic cardiomyopathy. It is a general information, not a diagnosis. If you or someone close to you has concerning symptoms or family history, consult a healthcare professional for proper evaluation. Okay, guys, that is A for you. I'll be back on with B shortly. Give me a bit for B, please. And I'll be back on with that for you. For now, Gator Wellness, take care, folks. And for everybody's FYI, I have a start of a discussion for live chat. I put the topic we are doing, and so everybody could get a grasp on what we were up discussing, and maybe we can do a chat with this headline. The headline is the hypertrophic cardiomyopathy discussion. So with that being said, I'll sit here for a few minutes to see if anybody wants to know more about the condition I just did for the show. Then I can answer questions.